Hey, good morning, team. Major General Wilcox here from my office here in IMSC. I said to Mike Briggs the other day, I said, hey, let's try to have a Facebook Live event. I put a couple of emails out to the team, one on Monday, one on Wednesday. But I said, let's try and make sure we have another option. Just because folks that are teleworking, I know the VPN has problems. I know we got Aragon out there. Some days it works better than others. But this venue right here, you can track me in with your iPhone. So I was trying to come up with something to get off of the military system that's really bogged down, at times, and give you an opportunity to ask me questions or anything that's on your mind about how IMSC, Air Force IMSC, is handling the COVID-19 virus. Let me start out by saying just initially that I am not the complete smart guy on everything. I admitted up front. I got some friends that are here with me today from the Services Center. Donna Turner's here from the Services Center. Rob Jackson's with me. They can't hear you or see your questions, but I'll throw something to them. The First Sergeant's here with me. Colonel Heckel and a few of his staff members from the Director of Staff, and Paul Lane's here as well. So if I can't answer it, I'm going to throw something to them. If I can't answer it by the end of this Facebook Live event, with the rest of the answers, we'll post it as part of the comments or, a follow-up on the Facebook Live event. And if this is successful, maybe we'll do it again next week. I'm just trying new things so we can communicate. So going into it, I think we're in, the Air Force is in a pretty good shape as far as COVID-19. The Air Force, AFIMSC, General Bunch, and my top priority is taking care of you, our great workforce, and taking care of your families to make sure we keep you healthy while at the same time, we're keeping the mission going. We got 77 installations, 9 MAGCOMs, the half, Pacific, Europe, the folks in the Middle East right now that are conducting missions that rely on us every day. So obviously we got to keep the mission going. But I look at it that in order to keep that mission, going, I got to keep you healthy. For multiple reasons, I wish we could go to 100% telework. Unfortunately, there's systems that we're still working through IT upgrades. We have a few of them in IMSC where there is one system and one system only, and you can't go somewhere else to log in. We're in the process of working through what that looks like if we do have to go someplace else, whether it's running a long wire to another facility or a temporary environment. But I'd say probably today we're at about 80% telework across the Air Force IMSC enterprise. And I'm encouraging as much telework as we possibly can get done. The building itself is still open. So if folks have to come in once a week to plug in, to download, to get information, that can still happen. And I've pushed all that down to our great directors and PSU commanders and the 10 det commanders that we have out there to help do that and make that reality. In fact, I teleworked on Tuesday, and then I teleworked yesterday, but I still phoned in to the meetings with AFIMSC, to our CAD update every single day. I know VPN can be a challenge and the EuroRAM can be a challenge. Sometimes I was able to be on there. Try Outlook webmail, try the VPN. But what we don't want to do is pull everybody back in because we're having VPN problems. That is not the intent. The intent is to protect the workforce, protect you, so we can get the mission going. And we've been able to transition through that this week. We are looking at those mission essential functions that we have to get done that we can't do anywhere else. There's a lot of things that we do that the rest of the force relies on us for, like getting paid in some areas that we work. I use our services NAF. I talk about our services NAF payroll function all the time. where we have one system and it's right here. Whether that's right or wrong, we can work on that, as we get through. We used to look at mission essential days, and we used to look at something like a hurricane or a tornado or a snowstorm if you're up north. Mission essential and operating through an environment like this, we're seeing the Air Force and we're putting policies out saying, hey, this is going to be, at least through, 60 days. A lot of the stop travel actions that we're taking are out through May the 11th. And then the country's looking at even farther, 60 to 90 days, in order to help flatten the curve of the virus so we can get on the tail end. So different times than we're used to operating in San Antonio, Texas, or Florida, Langley, Virginia, different places, different times. So we don't have all the answers either, but we're working through with our smart folks, our smart workforce, our smart communities, our MAGCOMs, the bases, and the Air Force. We're working through these things as we look out and move out into that 60 to 90 day period. But ultimately, I think you've seen some actions that we took this week and some things that we've done jumping out in front of a lot of others on sending people home and moving toward max telework. So that just kind of kicks it off. I know there's some questions out there. That's the main reason we really wanted to have this Facebook Live event, so you could ask questions and so I could potentially help alleviate some of your concerns. Or if I don't have the answer, I can take that and go back and get it. But, I think the biggest thing we can do as a community right now is, be calm, evaluate what's coming into us, pick the best course of action based on what we know, and then kind of move forward. So, Mike, I think we got some questions, don't we?
Yes, sir. So there's concerns both about VPN and telework. I think you just addressed some of the VPN, and we'll see if we need to get more specific with that. But let's start with these telework questions. I think you've addressed this with the leadership team, and this is a good time for you to tell this to everyone who's watching on our team and others, your philosophy about telework. So I'll just read the 4 or 5 questions we have on that so far. I think your overarching answers can kind of touch on all of these.
Okay.
First, will there be 100% teleworking? Second, what's a telework plan for our team members with elderly family members in their households and for team members whose significant others work in the medical field where they could be exposed? If we're supposed to eliminate gatherings of 10 people or more, eliminate exposure to surfaces outside the home, etc., why are we still business as usual at JBSA Lackland? And the final one, my organization has reduced staff, but only by 50%. Why are we still being required to come to work and risk our health as well as the health of our families? Okay,
now there's about 4 different things in there, so I'm going to try to unpack that, and I'll start with telework first. Right now, I've encouraged maximum telework. If you can do your job by telework, then start by next week. I've encouraged folks to push that out and be on maximum telework. Some functions cannot do that. For the functions that cannot telework, that only have a system in this building, and we have several, then I have asked, and we did this last Thursday or Friday of last week, to break those functions up into a blue and silver or a blue, silver, and gold team so we can still keep that mission going, but not have everybody together in a single location. We rotate. Blue team comes in for a day, the next day silver comes in. Or blue team comes in for 2 or 3 days, then another 2 or 3 days silver comes in. Those individual directors and supervisors have to, plan that out based on the function that they're doing. But, nobody should be in here working 5 days a week. We should at least be on a split type function. JBSA, let me try to answer, why is JBSA business as usual? JBSA is not business as usual, at least Lackland. I can't talk to Randolph real well, and I can't talk for Fort Sam. But JBSA Lackland, starting more than a week ago, has limited all BMT and tech school graduations to only military. If you look at BMT graduation, they're not going to the parade ground. They're doing graduation internal, so they're not outside. No longer can the 7,000 or 8,000 parents and family members that come to a BMT graduation, they can't get on the base. So the base is not even letting those family members on. So if you've been at the BX for the last week or you've driven the streets over the last week, you'll notice there's a big change in the JBSA traffic flow on the gate. I'll tell you, Air Education and Training Command has deemed training one of those mission essential functions. BMT is a mission essential function that must keep going. Tech school has been deemed a mission essential function that has to keep going because it feeds the pipeline of the Air Force. If you stop those, you can never gain that back because there's no slack in the production capacity. So the commander of Air Education and Training Command, in conjunction with his commanders, have deemed that that's a mission essential function. Now they're taking a lot of steps within basic military training, as far as social distancing and to help with COVID-19. For instance, I saw today, the first 2 weeks of basic military training, there's a lot of social distancing and staying apart versus getting together in a large group. So JBSA is taking a lot of, and General Lenderman, if you look around, there's a lot of facilities on JBSA that are closed. Our gym facility here is closed. Our bistro has gone to takeout only, or if it hasn't, it will today or Monday. It's going to be only. We are increasing the cleaning capacity in the custodial contract of this building, of our IMSC Building 1, Building 2, the common areas, the hallways, the restrooms. We've upped that and in the process of upping that too. So there are some things, a lot of things that are going on through the 502nd Air Base Wing, who owns all three of the JBSA bases, as well as things that are going on across IMSC. The last question, I think, had to do with teleworking with regard to elderly or higher risk. Our telework policy, and we have put out, that we can take a look at the higher risk population. The last I heard, I am not a medical expert, don't quote me, on this, but it's the 60 and over, or kind of that 22 to 44 that are in there. So if you're 60 or over, absolutely, the telework option, even if you're in one of those mission critical functions, we can limit. We're looking at that on mission essential travel. Are you in that higher demographic? Is there somebody else that we can send you on mission essential travel? In the last week, since those exceptions have come out, I have not approved any mission essential exception to policy travel because we've been able to do a lot of that telework. So the TDYs that we have in the headquarters anyway, as far as IZ, XZ, the ones that fall under me, we haven't approved mission essential. Those have been put on the first general officer, SES, and the chain of command to do that. But I think the telework policy, if you have dependents, it's the same telework policy that we're putting that applies. And Rob's got something he's going to add here. We can adjust that based upon those demographics, though. So, Rob, what do you got, man? You can just talk and they can hear you.
Okay. I was just going to add additional goodness for the telework policy with regard to dependents and elder care. If you do have your children at home or your elderly care, DOD and SAFMR has approved an exception to that policy to allow you to telework to be able to do that too. The only stipulation is that if you are spending time during your telework period when you're actually feeding or actually providing the physical care for your children or your parents, you have to account for that time as leave. Otherwise, you are permitted to telework and still care for those folks in your home.
All right, good deal. Well, I probably didn't understand the crux of that question because that was more from the personnel side and how we code it. But we are well aware that the schools are closed and that the CDCs and child youth programs, while still operating, are at a reduced capacity because a lot of their providers are in the same situation as everybody else. But another reason why we're promoting, the maximum telework capacity, maximum telework policy. So I think we walked through all of those, Mike, the 4 telework. What else do you got for us?
So, are we in conversation, AFIMSC or AFCIC, with the Corps of Engineers on potential support to states for medical spaces? Do you know anything about that? I know that's in the news lately.
Yeah, I have not seen anything from that standpoint. We do not own any of the medical side of it in the Air Force IMSC. I know there's been some activations of units. I know some units are on standby across the Air Force. One of our contracting, ESSs does a lot. One of our contracting ESSs does a lot for the medical community as far as writing contracts, etc. But we have not, we're not part of the capacity, bed space, or hospital type capacity. Each installation commander is working with their local community on those specific needs. So if you're at Maxwell or you're at, Schriever or you're at Scott, those respective installation commanders are working, and here, 502nd is working with the local community to determine and maybe, shared bed space, how that's going to work through defense support to civil authorities, health and human services, etc.
Okay, this is an advanced question. We had 2 people ask about the same question yesterday. Is there any consideration for putting hand sanitizer stations in the halls near every door in the headquarters building? The custodial contract folks could refill them. I think this also applies across our enterprise for folks who have that same concern in their workspace. Right.
So the custodial contract we're going to hire, they're going to, I think, Kevin, bring on a couple more FTEs that do nothing but work the hallways and the restrooms, wiping down all day long. So they'll go through the building all day long and do that. We have also increased our order for custodial supplies. Kevin, you want to talk a little bit about that because he's in the middle of working that right now.
Yes, sir. So this is Colonel Heckler. So just want to let the team know that right here in the building, Building 1, we've worked really hard with JBSA to try to tap into their reserves. So they've got about a 60-day supply of reserves that they keep on hand at any given time. So they are going to do their best to spread that across all of JBSA. We are high on the priority list to tap into that, but understanding too that we've got to be sharing with the rest of the base. But the order is in. JBSA is going through that list, and we're hoping to get some supplies within the next week to help increase the amount of sanitizer stations across the entire building. So we already have the sanitizer stations. We just need the sanitizer to fill them, and so as soon as we get that, sir, we'll make sure that gets out.
But we do have increased sanitizer around the building. I mean, I've seen it. They're in gallon jugs and hand pump jugs, and things of that nature.
Absolutely, and so every PSU and directorate has gone out and taken inventory of the supplies that they have on hand, and they have made it available to everybody.
Right. I mean, we have not run out. Nobody's run out. We still have a significant amount in the building. But we are working to even increase that some more.
Yes, sir.
Thanks, Kevin.
You bet.
All right, Mike. What's next, man?
So, sir, you mentioned it in the telework policy part of what you're talking about, but someone's asking, are there estimates on when we might be allowed back in the building? I'm assuming that that alludes to when we might all be a workforce as one again, because you explained how the telework's going to work for the time being.
So there's 2 pieces of that question. The building is still open. If you have to come back in the building to plug in, get something, tag into a specific server that you may need every once in a while, that is still an option and you can still do that. I do not foresee us right now, right? The last stop movement letter that I got has nothing to do with teleworking, but the last stop movement where you cannot go TDY, PCSs are restricted, etc., goes out until May 11th. I do not think we will be out of the max telework for at least 30 to 60 days. So we need to start looking at that from the long term. I told the staff this morning in our morning update, hey, start looking out to that 60 to 90 days. What does it look like? How do we get into this new battle rhythm, for what it is? The nation continues to move stronger control measures to control COVID-19. California yesterday restricted everybody to their house. New York, the state of New York, asked folks, to stay in their house. I think we're going to see more and more of this as the numbers start to go up. As long as we are on the increase for COVID-19 cases in the nation, and we haven't flattened that curve yet, I think we'll at least stay in the current posture that we are. I'm trying hard not to have, to bring it in, COVID-19 into the building and have the building full of 1,000 or 1,500 people, because that poses a whole different problem that we have to do. And then you get into self-quarantine, secondary, tertiary, across the board. So we're working hard to do that. Did I mention how many we had at the beginning as an IMSC? Did I run through the numbers?
No, sir.
Okay.
I want to give that update now.
Yeah, I apologize. I just came out of the AFIMSC CAT update, and I passed on a lot of the same numbers. Right now, we're watching across the Air Force Installation and Mission Support Enterprise, global, worldwide, which includes all the installations, MAGCOMs. We're watching 207 people that are under some form of restricted movement for self-quarantine or what have you. Now, of that 207, 202 of them are asymptomatic. That means they're not showing any signs of being sick, but they traveled from a level 3 country in the Pacific. They traveled back from Europe, prior to us moving into this tighter posture. Everything I've seen, 2 to 14 days on the incubation period, averages 5, could be up to 11. So we still got a whole week's worth of those folks that have been on self-quarantine for that. Of those 207, five people across the enterprise have shown symptoms. Of those 5, 2 tested negative, and we haven't heard back from the other 3. But we have had some individuals that have known people, or second and third order effects of people that they've known, that we've had to say, hey, okay, you guys go home, this duty section go home, stay at home, self-monitor yourself just to make sure, and we'll come back to you in a week or 14 days to see how you're doing. There's some things I think that we all can do to make this better. If you're in a van pool, you may want to take a look at that. Do you want to ride with 6 or 7 different people to work every day, that's exposed to their 30 or 40? When you get back in the van, cumulatively that brings a much higher number than you would be exposed to driving your own vehicle, walking in, and doing your thing. So look at how you do that across the board also, because the more people you come in contact with, the more second and third order effects could be involved. Or somebody could be walking around that just hasn't shown those symptoms. So what else, Mike?
So we're going to get Mr. Jackson, our Director of Personnel, back up, because we had a question about home care and sick leave. If you are over 60 and have a health issue, do you have to have a doctor's note? And Mr. Jackson will address that one.
It's Rob Jackson again. Yes, to answer the question, if the employee is sick and applying for sick leave, typically under normal conditions, a doctor's note is not necessarily required for that.
Okay.
Apply for sick leave. If we were looking also addressing at a longer term and we're talking reasonable accommodations, then yes, it will require medical doctor certification to get that reasonable accommodation process. Now, as we start to look into weather and safety leave, then we also would need to look to have some evidence that may, and it depends on the situation, that may require some additional certification for those employees that may qualify or fall into those at-risk categories that have been identified, which it would be the 60 and over, some with the breathing conditions and such, sir.
Correct.
So it's going to depend. That's the short answer, but this just kind of gives you some of the scenarios that we have. But under normal sick leave, doesn't necessarily require a doctor.
Okay, good. And I would say if you got a specific question in a specific case, call. Give us a call. Call Rob Jackson. He's in our DP shop here at Air Force IMSC, so he could answer it. I will also say that every day we get more guidance coming out of Air Force Personnel Center on what can be done, what can be waived, how to respond. The first thing they put out, one of the first big things was a stop movement, because that was in conjunction with the Secretary of Defense's guidance. Then about 3 days later, we started getting guidance on, hey, the physical fitness test is going to be now canceled and pushed 6 months. So as the Air Force Personnel Center works through, these different scenarios, we're starting to get guidance, and guidance is flowing. We got a SharePoint site out there that folks can go to and take a look and, hopefully answer a lot of these questions. Mike Briggs, our PA, is putting it all together every couple days and is sending out a big email at the end of the day with links. But don't sit at home with a question. Email us, call us, something like that. We'll work that issue and give it to you. And if it's something we haven't thought of, we'll push that back up to AFPC. On the NAF side, we expect some NAF personnel policy guidance, hopefully today. Colonel Turner and Joanne have been working diligently for the last 3 days with half A1C, and I think they're pretty close to finalizing that guidance, that should be out sometime today. I'm hoping today, and we will push that to you, and we're also going to push that to the rest of the MAGCOMs, because we're kind of the conduit there. So great DP questions. That's why I had to have my friend Rob Jackson come. All right, Mike.
All right, sir. So we received a comment that it's kind of weird to hear other voices coming on camera but not actually seeing them. I just want to address that. We're practicing social distancing here, so we didn't want to have a bunch of people close to you sitting at one table. So that's why we're getting close enough to get on the mic to ask and answer the questions. So I hope that makes that understandable to people, that we're not all on camera at one time.
Yeah, I apologize for that. We're online with you guys. So you're using your cell phone, and I got a tablet that's about this big in front of me with a little camera on it, and it's on a fixed stand. So for fear of moving it, dropping it, screwing up the connection, you'll hear people but won't see their voice. You get to look at this pretty face. I can't help you with that.
But people are liking some of the background police shields
All right.
and things like that. So going back to the hand sanitizers, I think you might have said something about a 30-gallon jug. I don't believe we actually have a 30-gallon jug. But
if I did, I'm sorry.
Yeah,
we don't have a 30-gallon jug.
We're ordering it in bulk so we can put hand stations around. And then the follow-up question to that is, do sanitizers actually work on viruses?
I'm not the medical folks. I'm not gonna try to answer that one. All I hear though is wash your hands, sanitize your hands, as much as possible, and it gets it off. I would really have to ask you. I think if you go to the CDC website, which we have kicked out in several different formats, our COVID-19 website that Mike Briggs has been keeping up on Facebook, I think has the CDC link and website there. If you go to that, that'll answer your questions on the best products to use, because there are CDC approved products, and part of the products that we're buying in the contracts that we purchase, that's one of the line items that we make sure that they're both EPA and CDC approved. So
I know, I don't know if you can answer this, it's an IT question, but just to let people know we received it, and if we can't answer it here, we'll get an answer. How often do folks need to who are teleworking need to dock their laptops to avoid a quarantine of their laptops?
I can answer this question.
You can answer it?
I can.
And is there a way to get those updates from home?
All right. So we don't have a lot of good things about IT system, all right? But I'll walk through where we're at kind of with the IT system as an Air Force. In the last week, we've probably increased, not we, IMSC, the Air Force has increased the VPN and the dialing capacity to over 240,000. From about 60 or 70,000 to 240,000. 16th Air Force and the Air Force A6 are working to even push that up. Part of what they've done, because they realized the telework process, was suspend the requirement for you to bring it in and put it in the docking station. So if you don't dock your computer within a week or 30 days like it previously was, it shut down and would turn off. That should not happen. You should be safe. We don't want people just coming back into the building just to dock their computer and be exposed to the folks all the way downtown and everything else. So if you have a problem, please let us know. But that was one of the things we talked about on the AFIMSC update this morning that was pushed to us that says you do not have to plug your computer in order for it to stay operational. And those big patches should have been paused also. You can get patches pushed over VPN, but when it's maxed out with 240,000 people, it's not going to work. I'd encourage you on VPN. We have the old VPN system that your computer probably has, and you have the new system called URAM. Both of those are in the menu when you pull VPN up to use. The new one is an icon, but if you want to look at the old one, it says VPN. It's in the same menu that shows which Wi-Fi you can pick, and it says VPN at the top. The old one's still working. The new one's still working. It gives us added capacity. It's not always the best system. Sometimes you got to play with the old VPN on which base you're dialing into. Right, Pat? Hey, if it's daytime here and nighttime in USAFE, go to Ramstein. Same thing at Guam, and you have a better chance to get in. But so far, for the most part, it appears to be working, and I'll say fair. Good at some times, bad at some times. Thanks, Mike.
Thanks, sir. So here's looks like one of our teammates from out at the RM at Ellsworth. I work at a cube city. Any suggestions to ease my concern?
Absolutely. One of the biggest and best things that the CDC and Health and Human Services and everybody is pushing is clean those areas. Clean those areas, once or twice, 3 times a day, with the Clorox wipe or the cleaning stuff that we have in the building. Clean that, clean those common areas. Practice social distancing. Social distancing is at least keeping 6 foot, if not 10 foot. Cubes, you can keep within 6 foot. You start walking. Everybody wants to get at the cube thing and hang out on the cube divider and talk or whatever. So you really got to work hard to do this. This is not a natural human thing where you don't walk up and shake hands or bump, or elbows. I've started the foot tap, right? So you stick your foot out 4 feet and the other guy sticks their foot out 4 feet as a hello. But really, I think if you keep your areas clean, sanitize it periodically, avoid, it takes everybody outside of work. This is an individual responsibility, a national individual responsibility that it's going to take us all to change the way that we operate and live on a daily basis. Americans don't like to be confined. We don't like to be told to stay in our house. We want to go play bingo. We want to go to church. We want to go to the store. We want to go to the sporting events. The more, of that you can reduce, and reduce the exposure to the people that are carrying it that you don't know, the more we reduce our, likelihood of catching it. Now, talking to just our folks at Ellsworth, you're one of those unique, one-of-a-kind, can only operate out of, that building there for DFAS. So we're looking at a blue and a silver and maybe even a gold on how do we break those shifts up so everybody is not there at the same time. Ms. Anders was looking at that. We were talking about that this morning, and I think you'll see some direction of that coming down. Now, luckily, Rapid City is a little bit farther behind the rest of the nation as far as exposed cases. So we're balancing all that on where we are off base, and your installation commanders are monitoring that, and where we are off base as they ratchet up the health protection condition. It's kind of like a force protection condition, right? If you're in force protection condition normal, Alpha, Bravo, Charlie, there's a health protection condition, and there's associated measures for Alpha, Bravo, and Charlie. And across the Air Force enterprise and even the Air Force IMSC enterprise, right now we got folks anywhere at installations from health protection condition Alpha up to health protection condition Charlie. So there are measures. Take a look at those health protection conditions. If you don't have them, send it back. We'll send you, some of what those checklists look like and things you can do and that are recommended in each and every one of those different health protection conditions that'll help get after that. Your installation has that. Your own installation has it to where everybody on the installation is operating off the same sheet of music. Over.
So while you were answering that, we got two follow-on questions. I believe you addressed the one about the telework, and I'm sure the team concept would answer this one.
Okay.
What if you work 3 feet from your cube mate?
Well, I would look at operating in a different cube. Right now, we're at 80% max telework. So can you operate in a different cube? Can you move to a cube that's not being used? Can you move to an empty cube? The way that the Air Force computer systems are worked now, unless you're tied into one of those specifics, and there's only a few of those, is you can dock your computer or plug your computer to any LAN section in the building, and you just have to go through it, and the LAN will work. So if you're 3 feet, I would take a look at, hey, can I spread out? Because 80%, at least in our building today, if you look outside, 70 to 80% of our folks are gone. When I walk through the hallways, there are not a lot of folks here. So, there's things that we can do proactively to look at that, to help spread you out if you have to be here. The other thing is, if you have to be here, hopefully 50% of your duty section's not, because they're part of that requirement. So move over and use one of their desks, or another area in the building that we can do. I fully support that. And if we have IT problems as we do that, we'll have to do it. Great. That was a great question. Okay, Mike.
How often are you in contact with local and military leadership?
We are tied in with the local JBSA 502nd CAT every single day. We attend 502nd CAT updates every day. I don't update and attend. We have EM emergency managers that are part of our director of staff that do nothing but this, and they link us in and tie us in twice a day. I think it's twice a day, Kevin, once or twice a day. Twice a day, that we're tied in with the 502nd. We're also tied in with the 502nd through Port San Antonio, who's got our contracts that are tied in with them. We're tied in with the 502nd on an advisory role, just like we advise 77 installations a day. Starting next week, we're going to step back up and crank Mission Support Group DCSs up. So we get calls from the Mission Support Group of the 502nd. We get calls from Randolph, Fort Sam, all the other installations daily. Brigadier General Lenderman, anytime she changes a policy, she sends it to the senior leaders on Lackland. And if I have a question, I shoot it right back to her. So I think we got pretty good comms with the 502nd. I do not have deep comms day to day, nor do I have right now with, say, the 12th Fighter Wing or the 12th Training Wing over at Randolph, the Army units on Fort Sam, the 37th Training Wing, unless they call us. The kind of the command and control, everything for a joint base goes through the 502nd, and we are 100% tied in with the 502nd.
Okay, sir, we have another personnel question, and I'll read it, and then we have two different people coming up to provide a response. If a civilian becomes ill and gets diagnosed with COVID-19 within 14 days of working customer service, is it a workers' comp issue, or is the civilian responsible for their own medical payments, etc.? So first, on the non-appropriated side of the house, Colonel Donna Turner, our Air Force Services Center Commander, will speak to that.
She can talk to the NAF side. All right, Donna.
Yes, sir. So for a NAF employee, workman's compensation may apply if we can determine that the disease was contracted in the workplace. And if a NAF employee believes that their condition is workplace related and chooses to file a workman's compensation claim, that claim will be fully investigated and adjudicated in accordance with our standard Air Force workers' compensation procedures. So there's no changes to that under this COVID-19 environment. For NAF employees that are enrolled in the NAF medical plan that's administered by Aetna, all your copays and your costs associated with testing and the diagnosis for COVID-19 are fully covered.
That's
Okay.
awesome right there.
Now, Mr. Rob Jackson, our Director of Personnel, will talk about the appropriated side of the house.
From the appropriated fund side, exposure to COVID-19 alone obviously does not constitute a work-related injury that entitles immediately the employee to medical treatment under workman's comp. The employee must first be actually diagnosed with COVID-19 to potentially be afforded coverage. To establish that coverage, the employee must file a claim with the Department of Labor, who has the final approval authority. Information on the workman's compensation for COVID-19 is on the Department of Labor Workman's Compensation Program website. We can get that out to y'all, and we'll also have it on the SharePoint site, have that information available to you. But it's www.dol.gov, OWCP, DFFC info for corona coverage virus. We'll get it out.
We'll
so you
hang
have
it on the
all.
SharePoint
Yes, sir.
side. But I think kind of, Rob, did I hear you say similar to the NAF?
Yes,
If you catch it from being in the workplace, you know, it's covered. Is that what we went through?
It will generally be covered.
Okay.
I will say, just from the conversations that we had with a few of the experts, that much like some of the other workman's compensation claims for appropriated fund employees, the burden of proof that the cause and source of injury or disease in this case is going to be on the employee
Okay.
to push that.
So kind of in
we'll
line
support
with
there.
normal processes
Yes, sir.
and procedures.
Yes,
Okay.
sir. Yes, sir.
So everybody understands how that works.
Yes, sir.
Okay.
We did have one question.
Okay.
If I can
Yeah,
address.
keep going.
Folks were interested in points of contact.
All right,
in
do
DP, so I wanted to make sure I got those numbers to you.
I quit looking at Rob. You guys are wondering who I'm looking at.
6 feet away.
I would say the primary first line of defense for us is Miss Sean Burns Harris, and she's at DSN 969-0911. How appropriate. 0911 when you need help. Miss Jennifer Gomez, our Chief of Personnel Programs, DSN 969-8347, and of course myself, DSN 969-9124, and commercial prefix here in San Antonio 210395. If you just have general questions that you want to get addressed to ensure that somebody gets it and you don't want to send it to the individual boxes, send it to Air Force IMSC DP workflow, and we'll make sure we get them addressed for you. Thanks, sir.
Thanks, Rob.
Okay, sir, here's one from online. In light of many personnel at the installations on admin leave or teleworking, is there any thought on giving some relief on non-essential and routine suspenses and taskers? In other words, they're indicating we need some air staff and OSD relief during these times. What's your thought on that?
We were actually talking about this morning. So General Bunch put out last week that, hey, our number one thing right now, and we put it out also, our number one thing is taking care of, you know, our family members. Our number one thing is taking care of our workforce, you know, both military, civilian, the contractors that are with us are globally. That's our number one priority. We got to keep the mission going too. We have to work. So if it's COVID-19 response related, you know, that is more of the priority right now. And how do we get the things, take care of the workforce? But we do have the normal mission things that keep going. I fully realize that on a maximum telework operation, we're not as effective because the IT functions are not as effective. So if you have routine things, or if somebody is sending you a hot suspense on something that's not COVID-19 or taking care of the workforce, that can wait, then push back on it. If you can't push back, push it up your chain. You can push it up to me. I told in our update this meeting this morning that things are going to move right. We know suspensors are going to move right. If there is a routine thing that we got to do and it slides to the right, it'll slide to the right. Because if we don't slide it to the right, if you want it fast, you're going to get trash, right? You want it quick, I get it to you quick, but it won't be good. So those things that are workforce related, taking care of the force, taking care of the COVID-19 things for our installations, and providing information, and then kind of those routine things. There's a lot of routine things that I know have to keep going. The Air Force is manned, and we build, I think everybody in the nation is manned kind of to the steady state every day. And then you add COVID-19 and you increase the taskers, and then you make it harder because we put you on telework. So don't stress over those lower priority things. I got to trust you guys because you know what's in your job jar and what's important and what's not. But I tasked out some things earlier in the week on Monday that were Secretary of the Air Force related. And I said, hey, if I could have a response by Thursday because I got this meeting. Well, that meeting was sliding and it was sliding and it was sliding. And I pushed it to next week just because we needed more time to work it. There's a lot of budget things that are going on, POM things that are going on right now. But if we got to push back up, we will. If we just can't get a suspended, then we'll do our best to get the information turned in, and it may be a 75% solution, and that may be all we got. But let's try to push back and get some realism in the suspenses or the normal routine things that we can push back. I got it. If it's a routine thing, we got to push it back a week, we'll push it back a week. If I got to go back to half, we got to turn in this monthly report every month at the same time, I got it. Now, if it affects 40,000 people's pay, we're going to have to look and that's a higher priority than maybe something else we have to do. It may even be a higher priority than a COVID-19 thing at the time, which is why, we got each one of you is smart and understands your portfolio, and your supervision understands that. But I have no problem pushing back on those things that we can't get to or that have to slide right in order to do the more higher pressing things now. And I will back you up if you do that.
All right, sir. So we get about 10 minutes left.
Okay.
Really great session so far. We've had up to a ceiling, I think, of 500 folks online at any given time. We want to let those folks who are still monitoring us to go ahead and continue to submit your questions. If we don't get to them while we're on the air, so to speak, then we'll get to them in written responses and with an email blast here into our workforce as well. So if you have questions, keep them coming. We'll get them answered. And for the remainder of time, we've got 4 or 5 here in front of me. We'll see if we can get to them.
Okay, great.
Do you know if there's tests going to be provided for the workforce at some future date?
Tests
for the coronavirus.
I do not. They have pushed tests out. Shirt, maybe, I don't know if you've heard anything about this. Initially, they were keeping it at the CDC level. They're pushing them out. Some installations have the capability to test. I know Wright Pat has the capability to test. Kevin, do we know, is Lackland, the Wilford Hall Clinic, or AFIMSC have the ability to test?
They do, but
okay.
right now they're not going to test because of the number of available tests on hand. So they're not going to test everybody just to see if you have have the virus, but you have to be symptomatic or in close proximity to somebody else
okay.
who you confirm has had.
So I'll relay that in case you didn't hear. There's not a massive workforce-wide test that's gonna happen, and that's kind of problematic anyway. Because if you take a test and you leave your house and you go to this grocery store and you run across 5 people, you just negated the results of that test, or could have. With the limited tests as they ramp up the test production, there are enough tests. If you think you're positive, there's enough tests. If you have been associated with somebody that's tested positive, then you can work and get a test accomplished there. But it's not going to be a flu shot type lineup where everybody walks through and gets a test. not at this time. Good question. Did you have something else you wanted to add? Okay, good question.
Okay, so back to IT here for a minute. The help desk has definitely been overwhelmed, as we know. People showing up and wanting the updates on their computers, largely related to telework or teleworking and their computer having issues and having to bring it to the help desk. Is there any thought to providing that IT help desk via appointment only, so not to have this large queue of people gathered out the door?
Yep. Hey, that's a great point, and we'll take a look at that. I don't know. We won't be able to do it online if you can't log in to do it, but maybe we could do it, via iOS or something. Kevin, can we take that one? Or you want to talk to
Absolutely. So I think we can certainly work. Some appointment only for folks. I know with the teleworking business, and folks are trying to avoid, coming in too often or being in contact with folks. So we can certainly take a look at that. I do want to say, though, there are folks that have had VPN issues with the new VPN, and it's not exactly working like it should be. That's mainly because their standard desktop configuration has not been upgraded. So a lot of folks are now needing their computers to be re-imaged. That takes a couple hours to do. So we have set up we've taken over, basically commandeered a conference room near the Four Corners that has the ability to allow us to increase our capacity to be able to re-image multiple machines all at the same time. So we've increased our capacity of what we can what we can work. So hopefully we can have folks bring in their computers. We'll get them re-imaged and back out to them as soon as possible.
Okay, great. And then let's take a look at some potential, sign-up times. How do we do that? Because then again, that keeps the line down in the mass gatherings now. All right. Good input.
So we gave out some POC information earlier for personnel, and people have asked what's the commercial for that. So our DSN number is 969. Commercial number is 210395. Again, our DSN 969, which is the number you received. If you want to dial that commercially, it's 210395, and then the last four of those numbers that were provided earlier.
All right, I think we got time for maybe one or two more.
Yes, sir. And then some closing comments from you. So there was a question, is there any talk about shutting down child development centers or youth centers across the board? And Colonel Turner from the Services Center will address that.
Good afternoon, everybody. So as y'all know, installation child and youth programs are subject to the direction of those installation wing and command leadership. So there is not an across-the-board recommendation for shutting down them across their Air Force wide. We are leaving that up to the mission requirements of that installation command. We did provide some guidelines to the commanders on how they can assess their operations to see what they might need to do. Assessing your staffing requirements to determine whether or not you need to reduce your operating hours and or closing rooms and facilities as necessary. Prioritizing the use of your child and youth program staff to cover full-day childcare over recreational activities. Consider closure of the programs that are not full-day to include hourly care, part-day preschool, or Give Parents a Bake program. And then most importantly, as we work through this social distancing and trying to flatten the line of this, is that parents who can should be encouraged to keep their children at home to fully achieve proper social distancing while also allowing space for the children of mission essential personnel in our child and youth programs that are still open. One important note to note that if you do remove your child from care and you are not receiving child care services, we will not charge fees to those airmen and families as long as they're not using those slots, and you will not lose your slot as well. So when this pandemic is over, you will still have those slots. So again, care and safety of our airmen and families are utmost, but we do have some mission requirements for some installations, and we leave up those to commanders on when those operations will stay open.
Awesome. Thanks, Colonel Turner. Hey, team. I think we got about 2 minutes left. Hopefully this was successful and helpful to you. It keeps us from getting together in Building 2's auditorium. It keeps us from having a hall call. It keeps you from having to rely on VPN. Pretty much everybody has a cell phone that and a Facebook account these days. If we didn't answer your question, or if we did not get to a question that you potentially had, send it to us. Mike, where do we send that question?
So you can put it online right now. Or if after this event you want to email us, we have an Ask AFIMSC mailbox that's on our website, and the address is ask.afimsc at us.af.mil. ask.afimsc at us.af.mil.
Thanks, Mike. And give us some feedback, too. So shoot Mike or put a comment under the Facebook Live if it's possible, if this was worth it or not. Somebody told me we had up to 500 people on the Facebook Live here in the last hour, up to 500. In closing, I want to just say thanks. I want to say thanks for what you do. We've never gone through this before. We've never gone through it as a nation. Mission Essential and, teleworking was 1 day or 2 days. Having to go to Mission Essential personnel was because a hurricane was blowing through. We lost power or we got a snowstorm. It was a short-term event. We're going to learn some more things as we go through this. 30, 60, 90 days, we're going to learn more about what Mission Essential is. And I think we're going to get into a better battle rhythm as we go teleworking. Stay at home. Practice those good CDC-approved personal hygiene. Practice social distancing. We got folks that are coming to work in this building that are dialing into meetings. And I encourage that 100%. We don't want everybody sitting in a room in Warfighter 1 or in a big conference room in close proximity of each other. So take care of yourselves. Take care of your families. If we can do that, then we'll all take care of the mission because we know how to do it and we're pretty good at it. Have a good weekend. We will still be in contact. We'll be doing telecons. We're in contact with AFIMSC. We're in contact with JBSA. That will all go over the weekend. If something changes or a status changes with Building 1, Building 2, DFAS up at Ellsworth, if something changes with one of those buildings, I will get it to you. Don't bite off on the rumor control. There was a lot of rumor control this week, and we worked through it, and it was a lot less than it was. Send that rumor up through your chain. We'll work it. We'll get the facts. We'll push it back to you. We'll take the appropriate action. But want to let you know, we've been transparent. We'll continue being transparent. Stay calm. We're in this together. We'll get through it together, and we'll come out on the other end that much stronger. Thanks for what you and your family do.